I want to begin by offering sincere condolences on behalf of the people of Toronto to Her Majesty Queen Elizabeth, the royal family, and to the people of Great Britain and the entire Commonwealth on the passing of His Royal Highness the Duke of Edinburgh. Prince Philip's connection to Toronto was a deep and heartfelt one. He visited our city of Toronto 20 times, beginning in 1951, when he accompanied then Princess Elizabeth on a tour that she made in place of her ailing father, King George. His most recent visit to Toronto was in 2013, when he came for the presentation of colours to the Royal Canadian Regiment at Queen's Park and to receive his insignia as Extra Companion of the Order of Canada and Extra Commander of the Order of Military Merit by the Governor-General at the Royal York Hotel. In the years between, Prince Philip accompanied Her Majesty on royal tours to our city and visited on his own for a myriad of events, including award presentations for the Duke of Edinburgh Awards, regimental visits, the opening of the Royal Winter Fair, and charitable events for the World Wildlife Fund. Prince Philip had a strong connection to the City of Toronto, and we are thankful for his public service and for his devotion to the Queen, who remains an example of stability and grace in unstable times to Canadians and to many others around the world. I have asked that flags on official flag poles at Toronto City Hall and across the city be lowered. The Toronto sign will also be dimmed in tribute to the life of Prince Philip. Details as to how the public can offer condolences online will follow shortly. But right now, our thoughts are with Her Majesty the Queen, with the entire royal family, and with the people of Great Britain and the entire Commonwealth at this very sad time. Our work to fight COVID-19 and get everyone vaccinated is continuing. To date, 684,809 COVID-19 vaccine doses have been administered in Toronto. That is more than Ottawa, Peel, and York all put together, and that is a substantial accomplishment with much more, of course, to be done. City of Toronto vaccination clinic bookings opened this morning to residents aged 50 and older from 53 postal codes identified as COVID-19 hotspots. This change will ensure that an additional 265,518 residents are eligible to book vaccine appointments at our city-run clinics. I'm very happy to report that the early response is very significant. More than 7,761 people booked appointments in the first hour this morning that registration was open, and that roughly represents 129 registrations per minute in that first hour. Following this week's provincial announcement, the Team Toronto approach is shifting further towards vaccinating essential workers where they live, in areas where we know there are high COVID-19 case counts. Hospital and healthcare partners have clinics up and running, vaccinating residents in hotspot neighborhoods right now. Yesterday, for example, Michael Garron Hospital and the East Toronto Health Partners held a pop-up clinic in the courtyard of a high-rise apartment building in Thorncliffe. And similarly, there are clinics of that kind happening in Thorncliffe and Flemington Park today and in other places around the city. Today, they will deploy these two mobile teams to two mosques in Thorncliffe and Flemington to vaccinate residents 18 and older. Both are considered hotspot neighborhoods. And this is an example of the kind of work that is going to be increasing as time goes on and as we get further details from the province. We are working with the province to finalize those details around this rollout, including the role of the city's mobile teams, and we will make those details available as soon as possible because we know there is tremendous interest in this important phase of the vaccination plan. It is a pleasure for me to be here today with Councillor Jennifer McKelvey, the Chair of the Infrastructure and Environment Committee. We are announcing today the kickoff of our annual spring cleanup activities with one important exception. But the city's work never stops in this and many other areas. Throughout the pandemic, the lockdown, and even this stay-at-home order period, most city services have to continue, and they have to continue in a way that sometimes is even enhanced in terms of the quantity of those services we're making available to people. Sometimes they have to be done in different ways. That's our job. Toronto never looks its best in those first few days when winter is coming to an end and spring is upon us, and this year is no exception. And so we are working right now at cleaning up our public spaces for spring and to prepare those spaces for anticipated increased use in the warmer months. We know that people will want to use these spaces perhaps even more than they did last year when it was the first year we experienced restrictions due to public health concerns. And we have to prepare these spaces for residents to use as quickly as we possibly can. So during the month of April and into early May, there will be more than 1,400 workers using more than 150 different pieces of equipment to do all kinds of things, such as cleaning parks and green spaces, sweeping and vacuuming streets and sidewalks, trails, and bike lanes, cleaning up bridges and removing graffiti, addressing illegal dumping, removing snow fences, pruning trees, clearing catch basins to help prevent flooding during instances of heavy rainfall in the warmer months, and inspecting watercourses, clearing debris and blockages from storm outfalls, and identifying erosion issues around Toronto water infrastructure. These are just some of the things that will be done by the 1,400 workers in the coming days. We'll be trying to do them as quickly as possible and as early as possible this year. Beyond that, the Parks Department has worked to provide additional staff dedicated to clearing litter across Toronto's waterfront, including popular destination parks and beaches, starting in May. We will also have beach grooming starting in late April and stretching into early May, weather dependent, and this will continue throughout the summer season. This will include increasing the number of waste bins along the waterfront and emptying those in high traffic areas much more frequently. Last summer and into the winter, there was a call for more washrooms, and we answered that with an increase of available washrooms in our public spaces. We are opening park washrooms early this year. Park workers will start opening washrooms that were closed because they weren't winterized, and they'll be starting to do that next week, almost a full month ahead of schedule. The 46 park washrooms that are currently open will remain open for the year, and supplemental portable toilets that were installed over the winter will remain in place while the seasonal washrooms are being opened. We will continue to keep our parks open with many amenities available to the public when we remain in this stay-at-home order. And this includes more than 800 playgrounds and 30 parks with outdoor fitness equipment, outdoor sport courts, 70 outdoor table tennis and 60 chess tables, and 68 off-leash dog parks. Along with our parks, these playgrounds and courts are important destinations for safe outdoor activity for residents. And I emphasize the word safe. And safe means special attention to everyone when it comes to the matter of distance and keeping our distance from one another, people in particular that we do not live with. It means mask wearing, and it means, even distance aside, just not hanging out with people that we don't live with. This work being done will not only help our city make it more vibrant and make it more beautiful, but it will ensure that it is safer for everyone, including pedestrians and cyclists. Beyond that, of course, like I mentioned, we want to ensure that we are providing options for people to get outside during the stay-at-home order to enjoy some safe daily activity while respecting all of the public health measures. Public spaces have proven to be very valuable throughout the pandemic, and that will continue to be the case. And we want to make sure that we are taking care of those public spaces, which have had some extra use over the course of the winter months. And we want to make sure that they're in good shape to be used during the summer months after a very long winter. I have requested our parks officials and others to redouble efforts to make sure that our outdoor spaces and the usual spring cleaning effort are advanced in time. In other words, that we try to do them early to the greatest extent that we possibly can. And that is recognizing the fact there will be more people out and about trying to get some safe outdoor activity during the period of the stay-at-home order in the next short weeks. I know that they're doing their very best to get this work done as early as they possibly can. Yes, we all have to stay at home as much as possible right now, but we recognize the fact we have throughout that people need to have some safe outdoor activity in order to stay healthy, both physically and mentally. So the spring cleanup ensures that we can do all of that safely, and that the situations that we find ourselves in, whether it's on the streets or in the parks or other public spaces, are as good as they can possibly be. I want to make sure that I take this opportunity to say thank you to our city staff from transportation services, parks, forestry and recreation, solid waste management, Toronto Water, corporate real estate services, and others. They'll all be out in a full-fledged basis, all hands on deck, to clean up our public spaces, to get them ready as early as possible, earlier than most years in many cases, so that they can be safely enjoyed by people during this very challenging time. I would also like to say thank you to the residents of Toronto for doing their part to keep our city cleaner. I've been asked many times over the course of the pandemic about waste-related issues, sometimes including masks and other things that are put on the ground and just put places where they shouldn't be. And I would ask for people's cooperation over the period of the spring and summer months at all times of the year in making sure that they put litter where it belongs. There are plenty of receptacles to receive that. They will be cleaned more frequently in order to make sure we keep those spaces that we're using more often safe and clean for everybody. And I want to say thank you as well for residents who take that extra step to clean up parks and just to clean things up and do a little bit extra when they see things lying on the ground that shouldn't be there. Your efforts to clean up litter while you're out, they do make a difference. Before I finish, I do want to make mention in that particular regard of the fact that our community-based Clean Toronto Together campaign, which usually takes place at this time of year, will not take place this year for reasons of public health. We've had to postpone this popular event, which had literally thousands of people out in the month of April, helping to clean up parks and other public spaces and ravines. And it's extraordinary because I've been out many, many years myself, the things you find that people, for some reason or other, have left there during the course of the winter months: coffee cups, cans, you name it. And this is unfortunate, but we did clean it up each and every year, and tons of waste were taken away. But obviously an event like that is not consistent with the public health guidance that is in place at the moment. And so we've had to postpone it until the fall. But nonetheless, we do hope that people will take advantage of the opportunity to pick up some of those things they see and put them in the right place, and that people will avoid littering during a time when our public spaces are so important and so valuable to us. I know that we all share the desire to have a clean and beautiful city, especially when we're all trying to enjoy the outdoors as much as we can all together. But we do want people to know that hundreds of city workers are out right now doing this important spring cleaning, and we want to thank them for this effort. We all look forward to safely enjoying our public spaces, even more so this summer. And I, in conclusion, would say to people, please be safe. Please do whatever you can to follow public health guidance. And please, the minute you are eligible, take advantage of the opportunities in various different ways that are open to you to get yourself vaccinated, because these are the weapons that we have to address what are very, very dangerous numbers that we see with respect to the spread of COVID-19 and the variants. And the best weapons we have are the ones we should use: keeping our distance, following public health guidelines, wearing masks, washing our hands, making sure we socialize only with people that we live with, and getting vaccinated at the earliest possible opportunity. I want to say thank you for your patience. I want to say please continue to care for each other as well, making sure that you look in on people during the stay-at-home order, that you help them to get vaccinated if they need help either registering or getting to the site of the vaccination, and please get vaccinated yourself at the earliest possible opportunity. And now it is my pleasure to introduce Councillor from Scarborough and Chair of the Infrastructure and Environment Committee, Councillor Jennifer McKelvey.
Good morning and thank you. I'm Jennifer McKelvey, Chair of the Infrastructure and Environment Committee and Councillor for Scarborough Rouge Park. It's a pleasure to be here. Before we begin, I'd like to thank Mayor John Tory for his continued commitment to a cleaner environment that also means cleaner and safer roadways, parks, and public spaces. And thank you to the hundreds of essential city staff who are working together with COVID-19 safety protocols in place to clean and refresh our city this month. Our parks and green spaces are valued by the people and the families that use them, especially over the past year as we stayed close to home and explored the wonderful natural spaces we have available to us. These are the inviting parks and ravines that makes Toronto the envy of North American cities its size. Our parks and programs are innovative, our green spaces are vibrant and welcoming. They naturally attract people and provide opportunities for people to explore and enjoy nature. We are growing our bike network and trails at a rapid pace, and programs like ActiveTO are connecting neighborhoods to public spaces like never before. I'd like to thank city staff and crews who have been working throughout the pandemic to support the overall health and well-being of residents. It's important work. City crews have continued to work hard to keep public spaces clean and safe. Toronto's more than 1,500 parks, green, and natural areas, as well as public spaces, are destinations where people can seek out fresh air and exercise. And as we've moved through the pandemic, crews have continued to deliver maintenance and services such as garbage, recycling, and organics pickup, street and sidewalk sweeping, and diligently performed road, sidewalk, and bikeway repairs. So as we've done our part and done our best to make decisions and stay home and stop virus spread, essential city workers have remained busy doing necessary and essential work that makes our city one of the most livable in the world. Last year, city staff removed 74 tons of garbage and 14 tons of recyclables from 97 hectares of ravine land. While I'm grateful for their hard work, it's important to remind everyone to do their part to keep Toronto clean and safe by properly disposing of items in available street and park bins and not littering items on the ground. Let's all do our part. Thank you once again to everyone involved in this effort, and I look forward to a cleaner, safer city for all this spring.
Thank you, Mayor John Tory and Councillor McKelvey. We'll now begin the Q&A with the media. As a reminder, it's one question, one follow-up, and then please unmute yourself when you're called upon. We do also have staff on the line. If you do have any technical questions, including Mark Mills, Manager of Road Operations, Donna Kovis, Parks Director, Jane Arbor, Manager of PFNR, and Lisa Duncan, Director of Collection and Litter Operations. First up, we have Mark McAllister. Mark, go ahead.
Thank you very much. A question for Mayor Tory with regard to those that are now eligible from the hotspot areas identified by the postal codes. I'm just curious why the initial decision at this point, before the 18 plus age group is rolled out, why the decision that it would be from 50 years of age and above?
We've been embarked on a gradual program of taking the age down of people who could use the provincial system to register for the city-run clinics. And so this is really just a continuation of that trend of the age down. But in this case, we put the limitation around it to sort of focus our efforts, as we're doing everywhere else, on the targeted hotspots. And so we're using the 50 plus for targeted hotspots and seeing a very substantial response already today. And at the same time, the hospitals have already begun to do some of the clinics that allow for the 18 plus group to, on a local basis in hotspot areas, sign up. So that as more details become available and as we've had a chance to deploy resources to do more of the mobile pop-up local clinics in those same areas for the 18 plus group, obviously we'll have more of an opportunity to offer them the chance to get vaccinated. But we were trying to get going on the city clinics as soon as possible and to take down the age on a gradual basis, as we've been doing throughout. I should say, Mark, by the way, it's still the case that while there have been more younger people, and this is where Dr. Davila and Toronto Public Health can obviously provide you with more detailed information, as they have been doing. But while we have seen disturbing numbers of young people going into ICU and contracting the variants in particular with COVID-19, it is still the case that people in some of those more older age groups from 50 up still constitute the bulk of the cases that we're seeing of COVID-19. And as a result, it is appropriate, I think, that the city clinic should lower the age down, but at the same time focus on those groups as being the ones we want to sign up for appointments for vaccination.
Mark, do you have a follow-up?
Yes, I think the mayor anticipated my second question with what he had said, but obviously, yes, the age groups for those contracting COVID and going to hospital are much younger. So too are the ages of essential workers. I think technically working age group would be 18 to 54. So is it not essential to make sure that those under the age of 50 are getting vaccinated sooner?
Yes, and one of the things that has to happen in order for us to be able to vaccinate, say, 18 plus in city clinics, is to have a change in the booking system. And this is not a complaint at all. The booking system, as evidenced by the pace at which people have been signing up in the 50 plus group this morning, is working really well, flawlessly. And we were signing up 129 people per minute. But we have to make a further change, and that involves some software change to accommodate 18 plus, for example, being booked in the hotspot neighborhoods through the provincial booking system for city clinics. And that is something we will do. But again, it is one of those things that has to take place on a step-by-step basis. It's not something that happens with the flip of a switch. It can be done in relatively short order, and it will be done. But in the meantime, we have begun, and the hospital partners have begun to operate clinics for 18 plus in hotspot areas, as evidenced by the huge success of the one that took place in Thorncliffe Park yesterday, and where, for example, it is happening at 2 mosques in Thorncliffe and Flemington today. So those will continue, those will expand, and eventually the booking system, not too long from now, will be changed to accommodate that same age group in the hotspot areas at the city clinics.
Thank you, Mark. Next up, we have David Ryder from the Star. Go ahead, David.
Hi, everybody. Mayor, on CBC Radio this morning, you described your own situation, having signed up, I think, through a drugstore and waited and then bumped into somebody who said, oh, you should call around, and now you're still waiting. Isn't that kind of an indictment of maybe just the drugstore system? Like you guys had talked about one seamless system where anybody who's eligible can sign up and then have a choice of options. But the mayor of Toronto sounds like he's kind of scrambling around to get an appointment for his own vaccination.
Well, first of all, to your point about the mayor of Toronto, I've been very, very conscious because I know that that's what people would expect, not to in any way try and go around the system because I'm the mayor. And in fact, when I signed up, I did it myself online to go on these waiting lists on my own phone. I sat on the waiting list for some period of time. And then I did happen to run into somebody who told me that they have, because of canceled appointments, they end up having some walk-in doses every day. And if you show up, kind of at the right time, many people are having that experience of actually getting vaccinated. The pharmacy program was one that was administered through the province, and they made arrangements to both select those pharmacies. We helped them by supplementing that list with some other ones in areas that we didn't think had adequate coverage in some of the hotspot areas of the city. But then it turned out to be the case beyond the information that I learned just by happenstance about the availability of walk-in doses that you have to get on the phone. And of course, it's difficult for me to find the time to do that. So eventually we found some time that I got an appointment. If you just phone, you eventually find one that's either been canceled or that somebody else had. I didn't clear on the waiting list that I put myself on, but I've now found an appointment. I'm going to go and have it done. And, that's just the way the system works. But I think, it is the case. Many thousands of people are getting their vaccination at the pharmacies. I was anxious to continue to have it done at the pharmacy while I could have been eligible to have it done at a city clinic because we lowered the age, because I want to demonstrate to people that I have every confidence in the AstraZeneca vaccine, and I will receive that vaccine because I've had the same everybody else has, which is that all of these vaccines are safe. That one is safe, and I will receive it so that people can see that I'm receiving that as everybody else is in the pharmacies.
Thank you. And my follow-up is just following on Mark's question about the 18 plus people in the priority neighborhoods. I just wonder, like, those people were told you're eligible, but you can't yet register. And I think the word you used was soon. I just wonder, is that kind of a potential problem where you're sort of saying you can do it, but you can't do it, but you'll be able to do it soon? Like, should you in the province just have waited until the actual can make the change and say, okay, now sign up, because you've had this issue where spots have gone unfulfilled?
This change to 18 plus was a very welcome change, and we were glad the province made it. We're glad they made it with respect to hotspot areas that have been identified in Toronto and elsewhere. And we're now looking forward to moving forward as quickly as we possibly can to allow people 18 plus on a broader scale to get vaccinated. They do have that opportunity now in the neighborhoods where the hospital partners are running these mobile and other kinds of pop-up clinics. We have made the request, or will very shortly do so, in order to have the provincial registration system change so that that will also apply to the city-run clinics. But let's remember, this was a change in a policy and approach made less than 48 hours ago. We've moved quickly to make sure that those people have access to the vaccine as quickly as possible. And I think when the change is made, as I know it will be, to the registration system, we'll be able to do even more at our pop-up clinics. The object here is to get as many people in these hotspot areas, 18 plus, vaccinated as quickly as possible. And I think today's opening up to 50 plus in the hotspot areas is a very good start. Thousands of people are taking advantage of it. We want thousands more to do so over the weekend, and we will be increasingly vaccinating 18 plus on a greater and greater basis. But I think it was time to move forward with it, and everybody's doing the best they can to catch up with these changes and to make sure that we move forward as quickly as possible.
Thanks, David. And last question is Matt Tingley from Global. Go ahead, Matt.
Hi, good morning, Mayor Tory. I'm just wondering, the first initial period for the 133,000 appointments runs out on Sunday. I'm just wondering what assurances you've had from the province that, or do you have a number for the next allotment of appointments that will assure vaccine supply for the city clinics?
Well, we set the number of appointments that are offered in the city clinics, and of course, they're being offered weeks out, and so we have appointments booked out several weeks now. We set those based on the expectations we have, based on a delivery schedule for vaccines supplied to us by the province. And so we don't book appointments or allow appointments to be booked for a vaccine that we wouldn't have. Or put the other way, we only allow a number of appointments to be booked in the coming weeks that is equivalent to the vaccine that we've been guaranteed by the province. So I can just say that while we expect to ramp up our activities, and of course supply is a huge component in our ability to do that, ramp it up through some of the local efforts and so on, that we're not booking appointments or booking clinics overall on the Team Toronto effort that does not reflect the supply we anticipate having.
And just my follow-up is just about this weekend. You talked about the changes that just I guess good behavior with people in parks and everything like that, getting out and about this weekend. Rules have changed so much in the matter of a couple of weeks. And of course, there is good weather on the way, and there is that checkout factor. I'm just wondering, when it comes to enforcement and making sure that people do follow the rules, what the city is going to be doing this weekend.
Well, we had a report this morning from the enforcement officials, and they have a substantial number of people who've been assigned to parks and to beaches and to looking at some of the activities we've experienced in previous times when we've had shutdown orders. We're going to be trying to respond to complaints as well. A lot of this is complaint-based, so that when people see a large party that shouldn't be happening or see a fire that shouldn't be burning, we send people out to deal with that. But we really have to count on the fact, and I've just been always very straightforward about this, we don't have enough officers to go and attend to every street corner, every park, and we really have to rely on people. And they've been terrific. We need them to be terrific now, and they should want to be terrific, because the numbers are very, very disconcerting that we're experiencing right now with regard to case counts on these variants. The desire, I think, on the part of people is more intense than ever to have this whole thing behind us. And so those two go together. The best way in which we're going to get these numbers down, get this thing behind us, is to keep your distance, to use parks and other spaces in a proper way, not to have parties or other gatherings with people you don't live with, wear masks, and get vaccinated. And if people do that, and they've been terrific so far, then we'll be fine, and there won't be a big problem with enforcement. But there will be people out, lots of them, this weekend, trying to keep an eye out to make sure people are staying safe and not spoiling it for everybody else, both in terms of the ability to be outdoors and also in terms of the ability to get this nightmare over with.
That was the last question. Thank you, everybody, for joining us. Have a great weekend.
Thanks, Lana. Thanks, Jennifer.